Hello everyone. Welcome to my channel, where today we are going to talk about a very important topic, heart arrhythmias. Many people may not know, but arrhythmias are a serious problem that affects millions of people worldwide. So, in this video, I will share with you 6 important points that you need to know about heart arrhythmias, from the symptoms to the available treatments. So, if you or someone you know suffers from this problem or simply wants to learn more about it, keep watching. What are the types of arrhythmias? Heart arrhythmias can be classified in various ways depending on the origin, frequency, and rhythm of the heartbeats. This categorization is important so that the doctor can better understand the patient's condition and choose the most appropriate treatment. One way to classify arrhythmias is according to their origin, which can be atrial or ventricular. Atrial arrhythmias occur when there is a problem in the heart's electrical conduction in the upper part, called the atria, while ventricular arrhythmias occur when the problem occurs in the lower part of the heart, called the ventricles. Another way of classification is based on the frequency of heartbeats. Arrhythmias can be bradycardic when the heart beats slower than normal, or tachycardic when the heart beats faster than normal. This can cause symptoms such as dizziness, fatigue, and shortness of breath. The classification of arrhythmias can also be done based on the rhythm of heartbeats. Some arrhythmias can cause the heart to beat irregularly, such as atrial fibrillation, while others can cause the heart to beat in a rhythmic pattern but at an abnormal frequency, such as sinus tachycardia. Moreover, it is important to understand that some heart arrhythmias are benign and do not cause severe symptoms or health risks. Others, however, can be more serious and require more aggressive treatment, such as catheter ablation or the placement of a cardiac stimulation device, such as a pacemaker. What are the causes of heart arrhythmias? Heart arrhythmias affect millions of people worldwide. They can occur in people of all ages, including children, adolescents, adults, and the elderly. Arrhythmias can be caused by various conditions, including structural heart problems, heart disease, hormonal disorders, and the use of certain medications or drugs. Structural problems in the heart can cause heart arrhythmias when there is an alteration in the shape or size of the heart. These changes can interfere with the electrical conduction of the heart, which can lead to irregular heartbeats. Heart disease can also cause arrhythmias, especially in cases of heart failure, cardiomyopathy, and coronary artery disease. Hormonal disorders can also trigger heart arrhythmias. An example is hyperthyroidism, a condition in which the thyroid gland produces hormones in excess. This can lead to an increase in heart rate and, in some cases, arrhythmias. The use of certain medications can also cause heart arrhythmias in some patients. In addition, the use of recreational drugs such as cocaine and amphetamines can cause heart arrhythmias. These drugs can increase heart rate and blood pressure, which can lead to irregular heartbeats. Chronic alcohol use can also increase the risk of heart arrhythmias, especially in people with pre-existing heart disease. It is important to note that in some cases, the cause of heart arrhythmias is not known. These arrhythmias are called idiopathic and can occur in healthy individuals without any underlying condition. What are the symptoms of arrhythmias? The symptoms of heart arrhythmias can vary from person to person and can be mild or severe. Some people may not have any symptoms, while others may experience significant symptoms that affect their quality of life. The most common symptoms of arrhythmias include palpitations, shortness of breath, dizziness, fainting, chest pain, and fatigue. Palpitations are a common symptom of heart arrhythmias and are described as a sensation of irregular, fast, or strong heartbeats. Palpitations can be felt in the chest, throat, or head and may be accompanied by other symptoms such as shortness of breath or dizziness. Shortness of breath is another common symptom of heart arrhythmias and occurs when the heart is not pumping enough blood to the body. This can lead to a feeling of breathlessness or difficulty breathing. Shortness of breath may occur during physical activity or even at rest. Dizziness and fainting are also common symptoms of heart arrhythmias. This is because the brain is not receiving enough blood when the heart is beating irregularly. Dizziness can be mild or severe and may be accompanied by other symptoms, such as weakness and nausea. Chest pain is a less common symptom of heart arrhythmias, but it can still occur. Chest pain may be described as a pressure or tightness in the chest and may be confused with cardiac pain from other causes, such as angina. Finally, fatigue is a symptom that may occur with heart arrhythmias and is described as a feeling of tiredness or weakness. Fatigue may be caused by a lack of oxygen in the body due to decreased blood flow. It is important to recognize these symptoms in order to seek appropriate treatment for heart arrhythmias. Early diagnosis and proper treatment can reduce the risk of serious complications, such as stroke and heart failure. How is the diagnosis of arrhythmias made? The diagnosis of cardiac arrhythmias may involve various tests and procedures, depending on the type and severity of the arrhythmia. One of the most common tests is the electrocardiogram, or ECG, which is a simple and quick test that measures the electrical activity of the heart. The ECG can help identify cardiac arrhythmias and other anomalies in heart rhythm. In addition to the ECG, ambulatory cardiac monitoring, or Holter, is another useful test for the diagnosis of cardiac arrhythmias. The Holter is a portable device that is connected to the patient's body and records the electrical activity of the heart for a longer period of time, usually 24 to 48 hours. This allows doctors to evaluate the frequency and severity of arrhythmias during the patient's daily life. Electrophysiological study is an invasive procedure that is performed in a hospital or clinic and is usually reserved for more severe cases of cardiac arrhythmia. During the electrophysiological study, a catheter is inserted into a vein in the arm or leg and guided to the heart, where it is used to measure the electrical activity of the heart and identify the exact location of the arrhythmia. In some cases, other complementary tests may be necessary, such as imaging tests like echocardiography or cardiac magnetic resonance imaging, to evaluate the structure and function of the heart. Accurate diagnosis is essential to identify the underlying cause of arrhythmias and determine the most appropriate treatment for the patient. How is the treatment for arrhythmias? The treatment for cardiac arrhythmias can vary depending on the type and severity of the arrhythmia, as well as the underlying cause. In some cases, lifestyle changes may be sufficient to control the arrhythmias, including reducing alcohol and caffeine intake, quitting smoking, stress management, and adopting a healthy and balanced diet. When lifestyle changes are not enough, the use of antiarrhythmic medications may be necessary to control the heart rate and rhythm. These medications are prescribed by a doctor based on the type and severity of the arrhythmia and can help prevent more serious complications, such as stroke and heart failure. In more severe cases, invasive procedures may be necessary to control the arrhythmias. Ablation is a minimally invasive procedure in which the doctor uses a catheter to destroy small areas of heart tissue that are causing the arrhythmia. Pacemaker implantation is a surgical procedure in which a device is placed under the skin and connected to the heart to help regulate the heart rhythm. Implantation of a cardiac defibrillator, or ICD, is a similar procedure, but the device is capable of detecting and stopping more serious arrhythmias that can lead to cardiac arrest. It is important to remember that the treatment of cardiac arrhythmias is personalized for each patient and may involve a combination of lifestyle changes, medications, and invasive procedures. The goal is to control the arrhythmias and prevent more serious complications, such as stroke, heart failure, and sudden death. Regular follow-up with the doctor and compliance with the prescribed treatment plan are essential for effective control of cardiac arrhythmias. How to prevent heart arrhythmias? In addition to the mentioned risk factors, other health conditions can also increase the chances of developing heart arrhythmias, such as high blood pressure, diabetes, coronary artery disease, and thyroid problems. Controlling these conditions and receiving appropriate treatment can help prevent the onset of arrhythmias. Adopting healthy habits can also help prevent the development of heart arrhythmias. This includes following a healthy and balanced diet with low levels of fat and sodium, as well as regularly engaging in physical activity. Physical activity can improve heart health and reduce the risk of heart disease, which in turn decreases the chances of developing arrhythmias. Other prevention measures include avoiding excessive consumption of alcohol and tobacco, reducing stress in daily life, and controlling blood pressure and cholesterol levels. Getting enough sleep and controlling sleep apnea can also be important in preventing the onset of arrhythmias. Finally, it is important for people with a family history of heart arrhythmias or other heart diseases to be regularly monitored by a doctor and undergo routine exams to detect potential heart problems early on. Early diagnosis and treatment are essential for preventing more serious complications and ensuring heart health. And thus, we have come to the end of our video about 6 important points you need to know about cardiac arrhythmias. I hope it has been useful and informative for you. Remember that these are just some of the most popular topics related to cardiac arrhythmias and that proper diagnosis and treatment depend on the evaluation of a specialist doctor. If you have symptoms of arrhythmia or a family history of heart disease, be sure to seek medical help. Take good care of your heart. And if you like this video and believe it can be useful to others, don't hesitate to share it. Thank you for watching and see you in the next video.